Is the loose skin on your face or a sagging chin making you look tired or feel older even when you're well rested? If you're interested in how to dramatically rejuvenate your appearance to look younger and refreshed, a facelift can take years off your look, but one type of facelift definitely does not fit all. Each face ages differently, whether it involves sagging skin, wrinkles, or both. Here is what you need to know. Before moving forward with a facelift or any cosmetic enhancement, there are some basic guidelines you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one that is actually board certified in facial plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are several different types of procedures available: traditional, mini, and mid-facelift. The type of facelift you and your doctor choose will depend on the severity of skin laxity and other signs of aging you're looking to address. This video will educate you on the facelift procedure options your doctor might discuss with you. A traditional facelift is ideal for addressing multiple signs of aging, including excess facial skin, deep facial creases, and heavy lines and wrinkles. It's often performed using an SMAS, or submascular aponeurotic system, in which incisions are made near the ears, enabling deeper layers of muscle and tissue to be pulled tighter, while excess skin is removed and wrinkles are smoothed out. If you're looking to address early signs of aging in the mid-face, including the cheeks and nasolabial folds, a mini facelift may be the option for you. This limited incision option, usually placed at the temples and hairline area, allows your surgeon to access underlying tissue and muscle. A mid-facelift is a term used to describe a limited incision facelift that targets the middle portion of the face. This procedure is ideal for those candidates with deep folds around the mouth and mild sagging in the cheeks. It can be performed using endoscopic technology, cameras that allow surgeons to view and reach distant anatomies through very small incision sites. Imagining a younger-looking you is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't forget to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. You should come prepared with images you like, but keep in mind these photos should be used as inspiration only. Just because you like something doesn't mean it's right for you. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want and, more importantly, what you don't want. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Once all of your options are discussed and your questions are answered, it's time to book your appointment. Are your friends constantly telling you that you look exhausted or even sad? Are you frustrated with your wrinkle cream because the results are no longer satisfying? If you're bothered by persistent under-eye bags that no creams seem to alleviate, or droopy hooded lids that make you look tired or older than you actually are, an eye lift or blepharoplasty procedure can help rejuvenate your eyes and take years off your appearance. Before moving forward with any eye enhancement, there are some basic guidelines that you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons and make sure you're well educated and informed and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one who is actually board certified in facial plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are two types of eye lift surgeries, upper and lower, but oftentimes they're done together for a completely rejuvenated appearance. This video will educate you on all of the eye lift procedure options your doctor might discuss with you. An eye lift of the upper eyelids repositions fat and muscle and reduces excess skin to correct the drooping and puffiness that can make a person look older and tired. This procedure is also ideal for those whose eyelids interfere with vision. If it's your under-eye bags that bother you, a lower blepharoplasty is typically the best surgical solution. Lower eyelid surgery is not about removing the muscle, but rather using it as a bulking agent to add fullness to the area, allowing your eyes to look more natural. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Anticipating your results is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want, and more importantly, what you don't want. Once all of your options are discussed and your questions are answered, it's time to book your appointment.
therapy is completely unique in the fact that we can actually create that thermal response in tissue that we're looking for non-invasively at layers that a cosmetic surgeon likes to operate at when they're doing a facelift. Ultrasound can get to the deep parts of your skin layers without disrupting the surface. That ultrasound therapy goes below the surface of your skin to actually heat the tissue and create this response that generates new collagen and elastin.
I am thrilled that I did the Ultherapy treatment. When I look in the mirror, I feel like I look younger and better. I will say, though, that I noticed immediately the results. I went back to work right after the procedure, and one of the girls who sits near me said, "Did you get a nap at lunch?"
I am over 50 years old currently, and every year I have the same thought. I want to be 50 and fabulous. I want to be the best me that I can be at the age I am today. And I also want to do it with non-surgical intervention. So when Ultherapy hit the market, I did my research, and I thought, if this treatment works, this is exactly what I need.
Like many people, I just have a fear of surgery, and I chose to go ahead and do this as an alternative to surgery. I was expecting to have downtime and recovery or what have you, but there was no downtime or discomfort whatsoever afterwards.
After I had Ultherapy done, the number one thing that people would say to me out in public is, "You've lost weight, haven't you?" And I hadn't lost any weight, you know, so they were saying that because I think my face looked a little bit more toned. It had a lift to it. You should consider Ultherapy as a man because it makes you feel good. If you feel good, you go out and perform better. It's been taught through sports, it's been taught through competition, it's been taught in our society forever. There's no reason women should be the only ones to always feel good.
Initially, and it was almost instantly, there was honestly this lifted, smoother, tighter feeling to my skin and the way I looked. I had great lift on my eyelids, and I think that as time goes on, I've noticed like a smoothing out of my skin.
For me, it's all about looking natural. After my treatment, wow, I have an eyelid, and it looked good. And I noticed that as the weeks went on, the results just got better and better and better. It's something that's natural, which is what I like.
Algo que me influenció en mi decisión de tener Ultherapy es el hecho de que yo tengo 40 y pico años y realmente por dentro me siento como una persona de 33 años. Así que yo quería que mi cara muestra mis sentimientos por dentro. Los resultados que he visto es que siento que la cara está más apretada, la piel está más apretada. Me siento que la apariencia de mi piel se ve más joven y de hecho me siento que tengo más confianza.
수술하고 달리 울세라는 갑자기 변화가 일어나진 않지만 제가 제 경험상으로도 매일 아침 조금씩 변하는 게 느껴졌고 수개월 후에는 친구분들, 지인들도 제 얼굴을 보고 많이 얘기해 주셨고 저도 거울 볼 때마다 상당히 만족했었습니다.
A very important part for me in my physics, it's my décolletage because I only wear V-neck. It's as important for me as my face or my nose. I didn't want not to be able to wear V-neck at one point because my skin would look too old or that it would look strange.
And this morning we now have our special report, Wrinkle Rehab. This is where we explore the newest anti-aging therapies. And a star of the Real Housewives of New Jersey is trying an innovative new way to tone and tighten her skin and look years younger without surgery.
Ultherapy uses ultrasound to lift, tone, and tighten loose skin. Dr. William Song, here with another patient, says this is one of his favorite anti-aging therapies because there's zero downtime.
What kind of results do you see?
We're seeing a lift. We're seeing firming of the skin. It's more like turning back the clock.
Did it really make a difference?
It really did. I mean, I can tell a lift here.
Here is Jacqueline before, and this is after, but the results weren't instant.
Over, 3 to 6 months, it just gradually gets tighter and more tone.
Now, Entertainment Tonight, the worldwide leader in entertainment news.
And have you seen how terrific Courtney Cox looks these days? Well, let's get started with Courtney's beauty secret revealed.
90% of the time, I'm just such a positive person.
She may be labeled a cougar on TV, but in real life, Courtney Cox sure doesn't look like a woman about to turn 50. In part, that's because Cox has admitted to undergoing Ultherapy. No knives, no lasers. Ultherapy uses ultrasound technology to stimulate collagen production, which tightens the skin. From her friend's days to now, look at how the skin around her neck stays tight.
Here at Roxpa, we're seeing a huge demand for Ultherapy, especially moving into award season. This is a great treatment that is minimally invasive, minimal discomfort, and is something that you can do and be red carpet ready within a week.
Board-certified plastic and reconstructive surgeon Dr. Kevin Brenner says Ultherapy is great for people who don't need a facelift just yet.
Ultherapy you do once, and you start seeing results about 2 weeks after the treatment, and that results actually improve over approximately 3 to 6 months following the treatment.
The procedure takes just about an hour, may cause some redness, and cost between $2,500 and $3,500. Courtney admitted to trying Ultherapy, telling New You magazine, "You know what? I'm game for anything. I'm very open to trying to prolong the inevitable."
Tonight on 2020, The Cutting Edge.
Good evening. Never has the phrase out with the old, in with the new had truer meaning than tonight. And not just new, but radically new. The most cutting-edge procedures that often don't involve any cutting at all. 48-year-old Cherie Bowman has never had any cosmetic procedures.
I never actually ever went for even a facial.
Between the children and her work as a relationship coach, Cherie never had time for herself until now. Using a new device that delivers heat to shrink the tissue under the skin.
That feel okay? It's not a laser. It uses ultrasound, but not the kind of ultrasound you had during pregnancy. This is high-density focused ultrasound that delivers heat very deep, and that over time will give her a lift, both of the upper and the lower face.
3 weeks after her visit with Dr. Day, Cherie Bowman is getting used to her new face.
Before I noticed I'd have to pick my eyelid up to put the eyeliner on, and I don't have to do that anymore.
If you have all these treatments, does this mean that you will never look old?
Well, it may not be that you never look old, but we can slow that process down in a very natural way with these procedures.
So right now we're finding out the latest skin tightening tricks and slimming procedures without surgery from cosmetic dermatologist to the stars, Dr. Frederick Brandt.
So many patients don't want surgery, they don't want the downtime, or for medical reasons they can't. And Diane's been a patient of mine for a long time, and here we're using the same ultrasound energy, but instead of targeting fat, we're heating the deeper layers of the skin and the subcutaneous tissue. And you can see I'm applying the ultrasound, and it's very safe. There's a screen back there which shows the levels of the skin you're heating. And we're doing this procedure on the neck. It's going to take about a half an hour.
Okay. You obviously feel that it's worth it, right?
Absolutely.
Defying lines as a woman, that's sort of our focus as we get older.
I first started to see fine lines in my early 30s.
I noticed my parentheses getting a little more prominent and fine lines around the corners of my mouth.
I realized I needed to start changing my routine when a friend posted a reunion photo of me on Facebook. Frankly, I was a little more than surprised at the lines and the wrinkles on my face compared to my other classmates.
A friend mentioned to me that she was considering getting a filler. I didn't know too much about it, other than it was injected into the face to fill wrinkles and folds.
Personally, I wanted something that was not invasive, natural looking, and subtle. And I felt like you could get that with this, with the Juvederm XC.
What interested me about treatment with Juvederm XC, well, a number of things. Number one, I see, the process of time in my face a little bit. I see things that, have a little more lines.
My doctor told me that some fillers were made from hyaluronic acid, or HA. Over time, sunlight and other things can reduce the amount of HA in my skin and cause it to lose its structure, creating wrinkles.
I originally discussed treating just my parenthesis lines with my doctor. During our consultation, she informed me that Juvederm XC also works on my vertical lip lines, my marionette lines, as well as my corner lines. I decided to go for it all and get all 4 areas treated.
I was concerned about the outcome. Maybe the doctor would give me too much and the results wouldn't look natural. The actual injections were about 5 minutes. It was much faster than I thought it would be. It's definitely something I could have gotten on my lunch hour.
Yes, I'd get treated again. I've done my homework on Juvederm XC, and now I've seen the results for myself. I'd definitely return in a year for another treatment to maintain my look.
Oh my gosh, the results have just been amazing. I'm so happy with them because it is so natural looking, and I have actually had people say, "What did you do?"
I feel like my facial features reflect how I feel on the inside. Juvederm XC really diminished the look of these wrinkles. This area is smoother and still natural looking.
Let's face it, you had a great life, so it's left you with a few wrinkles. That doesn't mean you have to live with them. Hide the evidence with Radiesse, a unique calcium-based volumizing filler. Radiesse is strong enough for a man's rugged skin, but because it stimulates your body's own collagen, it looks and feels natural. You didn't get those wrinkles and creases overnight, but with Radiesse, you may be able to hide them immediately for up to a year or more in many patients. After injection, patient may experience redness, bruising, swelling, or other local side effects. Most side effects of treatment resolve within a few days. There's still time. Visit RadiesseMen.com now to learn more. Life has a way of keeping score. Radiesse. Hide the evidence.